comes the nuance police. Yes, babe, because multiple things can be true at the same time. Ariana Grande looks sick, and Ariana Grande probably is sick, and Ariana Grande is saying that she's not sick, and we as a society have a problem with talking about women's bodies, and Anna is a social disease, and her fans are going to see her and be socially influenced by her skinniness. And people with a history of EDs like me are triggered by seeing pictures and discussion of her. And we need to try to prevent this from becoming normalized. Just because we are not going to fix Ariana Grande on an individual level does not mean that we cannot have discussions about the impact of her appearance on society. That is what we do with celebrities. We talk about the impact that they have on society. I am not saying that Ariana Grande shouldn't be doing her tour. I'm not saying any of that, okay? I don't even want to wade into those waters because to me it feels very ableist. I think essentially we have three fundamental groups here. Number one, we have the people who claim to be concerned about Ari's individual health, okay? We have the second group, which are the people who are saying, don't talk about this because it's misogynistic. And then we have the third group of people who are interested in preventing the social spread because this is a social disease. We as a society have to talk about it. We have to. Even if at the individual level, it may make Ariana Grande worse. And I am sorry for presenting this trolley problem, but it's real. We can acknowledge multiple things to be true at the same time. We can acknowledge that it is not going to help Ariana Grande to see people saying online how ill she looks, that is going to push her further. We can understand that while also understanding that not saying anything about it at all is tacit encouragement if we don't want other women, especially young women, falling into this black hole of despair, which it very much is, which a lot of us can acknowledge because we've been there. Then we need to prevent that as a society. That is not sensationalism. Ariana Grande is a symptom of a larger societal problem. And unfortunately, she has now become the poster child for that larger societal problem. That is not her fault. And I have a lot of empathy for her that now she's in this position. But at the same time, she is a very public persona on a very public platform, and people look to her as an example, as a role model. And not even just young girls, not even just young women. There are people who are going to see the images of her and be triggered, and that is a societal problem. I'm just really frustrated by all of the people who are saying it's misogynistic to talk about women's bodies or it's inappropriate to talk about women's bodies, because the reality is we're not talking about women's bodies. We're talking about Ariana Grande's body. We're talking about a very specific body. And we're not dissecting it. We're not saying that she looks ugly. We are saying that we are concerned. I think it's hard because she should not necessarily be the sole person responsible for normalizing Anna or ED. It should not be just up to one singular pop star to be the face. It feels incredibly unfair, but that doesn't make it less true. It doesn't mean that she's not still on a public stage. It doesn't mean that she's not going to be influential to others, not just young girls, but also grown women. I follow people on here who are in their 50s who are saying that they're feeling triggered. Their mom had them on an insane restrictive diet when they were 13. This is a societal problem, and the sooner we acknowledge that, the sooner I think we can actually find a way to talk about it that is productive for us as a society. It doesn't make sense to pit ourselves against each other. People are so individually focused on Ariana that they're seeing this as like a personal human rights issue, but a society wherein nothing tastes as good as skinny feels, which is a quote that my friends used to have on their iPhone lock screen during college. We have to talk about it. And unfortunately, the reality is that Ariana Grande, for better or worse, is at the center of this conversation. So let's find a way to talk about it productively. And at the end of the day, I think genuinely everyone wants the same thing, which is for Ariana Grande to be happy and healthy, but we can't guarantee that. As a society, we can't guarantee that, and it's also not our responsibility, but it is our responsibility as a society to make sure that we're not creating conditions that are going to encourage this social disease on a societal scale.